Hello, world. Do you see me? Though hidden, I am here, waiting for the rest of my life to unfold. Soon I will arrive, and life as I know it will change. I will experience hunger and no contentment. I will feel pain and pleasure. I will make mistakes and overcome them. I will fall in love. And someday I will also bring new life into the world. Or will I? It's really not up to me. My entire life is before me. If only it is allowed to continue. Be my champion in the fight for my life.
I chose the topic of abortion because it's a very controversial topic, and also because more than 56 million women perform abortions every year in the world. Many of them do it without being truly informed about the abortion procedures, the physical and emotional complications of it. So today, I'm going to be presenting you with the statistics on why women choose to abort, the age group that performs the most abortions, the scientific proof of when life begins, and the development of babies in their mother's womb. Also, we're showing you types of procedures to abort the child, physical and mental health risk, and all of this I'll be showing you because I need to debunk some of the pro-choice arguments, okay, that it says that life doesn't start until later on, that says that most of the women that perform abortions are because they're either too young or not mentally ready to have babies, or because they're victims of some kind of sexual abuse. So today we're going to see the truth, not my opinion. It has nothing to do with my opinion. I will show you facts, okay? And if these arguments are being debunked, it's not because of what I wanted to say. It's just simply because of what the facts that I'm showing you and the scientific proofs that I'm showing you. So hopefully after you watch this video, and you will, this will persuade you to choose life and not death. So the first, what we're going to discuss about are the statistics to the Guttmacher Institute. Okay, it says approximately 56 million people, women, abort babies every year in the world. 25 million of those are illegal and not safe, of course. Not the other ones are safe, but we're going to discuss that later. Okay, in the United States, 862,000 abortions happened in 2019. That's a huge number, very, very large number, and worth of being worried. So who's having these abortions? Okay, why the women are choosing to abort? Okay, despite what many people might think, okay, the study made by the Guttmacher Institute says that only 0.5% of these women are victims of rape. 19% of the abortions happen and performed to mothers that they don't want to have any more kids. So they already had kids, they just don't want to have any more. Okay, 8% because they don't want to be single mothers. So poor decision making, in other words. Okay, they don't want to be single mothers. So, okay, and then 23% cannot afford a baby. 25% say that they're simply not ready for a child. So that will make you think that, okay, they're young, they're not ready for a child mentally, right? Okay, so let's see who's having the abortions. What age are those? You can see the percentage right there. According to the CDC, okay, only 0.2% of the abortions performed on a 15-year-old girls or younger. So it's not because of the age, because 90% of the abortions happen between the ages of 20 and 40 years old. And if you look at the chart again, 29.4% of the abortions happen between the age of 29 and 25 and 29. So they're mentally mature to have a baby. Okay, so when does life begins? Okay, again, so there's a false belief out there that says that life begins an implantation. Okay, which happens 5 to 14 days after fertilization. According to the embryologists from all different backgrounds and scientific encyclopedias and all the universities, okay, this is different. I'm only showing you two in my PowerPoint, the Princeton University and the Van Nostrand Encyclopedia, because they're very reputable. But all of them say the same thing. You can search for yourself if you don't believe me. Okay, life begins at fertilization. That's what they say. Okay, which happens 5 to 7 days after conception. What is fertilization? Simply the sperm cells meets the ovum. The union of these two fertilize the ovum, and it's called the zygote. Okay, this is when life begins. During fertilization, all the genetic composition of humans is formed. What this genetic information determines? It determines sex, eye color, hair color, facial features, and even some characteristics such as personality and intelligence. Also, okay, during fertilization, the 4 characteristics of life are present. What are those? Growth, reproduction, metabolism, and a response to a stimulus. So 4 weeks after fertilization, okay, the heart is beating and the circulatory system is in place. All right, specific brain components and internal organs such as the lungs are beginning to develop, and they could be identified. After 9 weeks of fertilization only, okay, more than 90% of the body structures found in an adult are present in the baby. Okay, the medical classification changes from embryo to fetus. Embryologists draw a line here to show you, to say, okay, what's the difference between fetus and embryo? Because a lot of people say, okay, embryo, fetus is when now they have a life. It has nothing to do. Life happens way back. Okay, the reason why it changes is because no new parts are forming. All right, the baby's just growing bigger, but all the parts are there. So that's the reason why it changes. Now, 10 weeks after fertilization, all the parts of the brain and spinal cord are formed. The heart pumps blood to every part of the body, and the whole body is sensitive to touch. Simple as that. Baby also can make facial expressions at this time. So that's amazing. 18 weeks after fertilization, the brain responsible for the functions of reasoning and memory and language, okay, which is the cerebral cortex, has the same number of nerve cells than a grown adult. So has the same neurons. Neurons do not go through mitosis. Okay, so you have the same neurons than you had back then when you were 18 weeks after fertilization. So you can't get any smarter than that. That's the way it is. Okay, neurons, you kill them, you're done. Okay, so also the baby feels pain. Remember that baby feels pain by the 18 weeks after fertilization. What are the procedures of abortion? The first one we're going to be discussing is called the medical abortion, which is performed only up to 10 months after fertilization. The steps are simple. You visit the abortion clinic. Okay, you take a pill containing mifepristone, which blocks progesterone action in the body. Progesterone is naturally created in the body, and it helps to stabilize the lining of the uterus. If you block the action of progesterone, the baby would die, and that's what you're looking for here, to kill the baby, right? 24 to 48 hours after taking mifepristone, the patient is given another drug called misoprostol, okay, and this will cause contractions, heavy bleeding, and what you're looking for here is for the baby to come out, for the mother to expose the baby. Where will she expose the baby? She will not expose the baby in the clinic. She will expose the baby in the toilet. Okay, and if she's very careful, she will be able to see and count the fingers and toes of that baby because they're there. All right. So, and then what she would do with the baby, she would flush it as it would be garbage, or who knows. Anyways, this procedure can take hours, days. Also, can be very painful. All right, and it has some very, very high risk side effects. What are those? Abdominal pain, nausea, diarrhea, vomiting, headaches, even maternal death. It can occur, or infection because of an undiagnosed ectopic pregnancy, which is very common, but we're not going to discuss that because that exceeds the purpose of this video. The second one is called the DNC, or dilation and curettage. Okay, this is a medical procedure that happens between 5 to 13 weeks after fertilization. And the first step is giving anesthesia to the baby, and then the abortion to the baby, to the mother. Then the abortionist will place the speculum into the vagina. Okay, the speculum is he will insert it in order to see the cervix. Once he sees the cervix, he would insert dilators to access the uterus. Okay, these dilators he would constantly put in and out to access the uterus and dilate the area even farther. Okay, remember that the baby has a heartbeat, arms, legs, fingers, toes, everything. The baby is there complete, but the bones are not calcified, so they're very soft. All right. So what's next? The suction catheter is inserted into the uterus. Suction catheter, as the name indicates, it's like a vacuum. Okay, it's a tube that has 20 times more power than a vacuum, and baby is just torn apart. It's sucked in through this tube and torn apart into pieces. The next step is the use of a curette. It's a long surgical instrument to scrape all the body parts left inside of the mother uterus to make sure there's nothing left behind, because it can cause infection. It could be very, very dangerous. Okay, what are the risk for this? The risk are perforation or laceration of the uterus, cervix, damage to the intestines, bladder, blood vessels, hemorrhages, and even infection. Okay, and you can also die of it. So you can also have future complications, pregnancy complications like loss of the baby, premature birth, and all of this just because of related trauma to the cervix. The next one is the second trimester abortion. It's called dilation and evacuation, or DNE. Okay, and this is performed between 13 and 24 weeks of pregnancy. Again, the patient gets anesthesia. Then the use of a speculum is used again to access the cervix. Then laminaria is inserted, which is a seaweed that it helps to dilate the area more, absorbs the water, and then expands, in making that possible the dilation of the cervix. So once this is done, the insertion of the laminaria, it's inserted 2-3 days after. Okay. She goes home. The patient goes home 2-3 days after she returns, and once she's back again, the abortionist would insert the catheter, suction tube, but not to suck the baby out, but instead suck the amniotic fluid out. Okay, the baby's too big to be sucked in through the small tube now, and the bones are calcified, so it's much harder to get it out. So how you get the baby out? Very simple, using a 13-inch long clamp. It's called a sulfur clamp. Okay, you take it out by pulling piece by piece the baby. Okay, the abortionist will grab a leg and pull, and you will hear the noise of the baby being torn apart. Arms, legs, chest, piece by piece. When it gets to the head must be crushed inside because it's too big. And how does the abortionist know that the baby has the head with the clamp? First of all, because of the crushing noise. The noise is very loud. The skull bones are very tough and very hard, so the noise will be extremely loud. And then also you will see a white substance coming out of the vagina, which is the baby's brain. The third, the next step, it will be the use of a scraping instrument, again, to take all the body parts inside of the uterus to make sure there's nothing left. And the most shocking part of all is the reconstruction of a baby, like it will be some type of puzzle and a tray. Okay, piece by piece, the abortionists have to make sure there's 2 arms, 2 legs, all the pieces of the skulls, and the placenta is there. So this is just insane. I don't even know how someone can do something like this. Terrible. Now the risk of this is uterine and cervical perforation, possible damage to the bowel, could be bladder, infection, bleeding, even maternal death can happen. Okay, and also you will have the same complications for future pregnancies. Now, the third trimester abortions are performed between 25 weeks and all the way to term. Okay, first an ultrasound is performed, then an injection of digoxin drug is administered to the baby through the abdomen of the mother. The abortionist will try to aim for the head or the heart of the baby. Okay, this drug usually is generally used for treating heart disease, but in high dose it can cause fatal cardiac arrest, and that's what they're looking for, to kill the baby. Now remember, the baby feels pain. Okay, just insane. Then they insert the laminaria to dilate the cervix, and then the mother is sent home or whatever she's staying. Now, while she waits 2-3 days for this dilation to happen, the mother can go into labor, and if she cannot make it to the clinic, she will be advised to give birth to that baby into a toilet. The labor pain is the same. It's just like delivering a normal baby, but in this case, instead of delivering in a hospital, you deliver it into a toilet and it's dead. Okay, absolutely insane and terrifying to think that someone can do something like that. Now, if the woman can get to the clinic, it will be exactly the same than the prior procedure. It will be a D&E, okay, dilation and evacuation. The baby will be torn apart piece by piece and put into a tray. Now, to think that people don't have any mental complications and many mental issues after this, it's absurd. Okay, any woman, any person that will go through this will not be okay after it. Okay, a study called the Soderbergh study found out that 60% of post-abortive women suffer emotional distress after the abortion. Okay, 16% of those women, the distress was classified as severe, and 70% of all the women that had an abortion said they would never do an abortion again because it was a traumatic experience. Another British study found that women that have aborted were 225% more likely to commit suicide than women that didn't. So today, in conclusion, I have presented you with statistics and numbers in which you'll see the reasons and the age groups of why and who aborts babies. Okay, I also have presented you with scientific proof from when life begins, the truth about the baby's development, the unbearable facts of abortion and the abortion procedures, the psychological and mental risk of these procedures. And to be 100% true with you, I would hope that you were receptive to all these facts that I have presented you, that you have seen the excruciating truth about abortion. And in this way, if you are pro-choice, let's give the choice to those that cannot choose for themselves, like babies. Babies can choose for themselves. Remember, okay, there's no bigger hero than those that protect the powerless. With this, I would like to leave you with the video.